Action.
Okay guys, we're going to start on upper extremity muscles. So if you get out your worksheet, we're going to start with the upper trapezius. My patient, sorry, she's running away already. So the trapezius muscle is one huge muscle. Okay, it comes off the neck, it attaches down here on the scapula. It goes all the way down through here. It looks like a big fan. So please refer to your pictures that we have loaded up on Schoology. But what we're going to talk about are the three different areas of the trapezius: the upper trapezius fibers, the middle, and the lower. It's all one muscle, but the different fibers, because of the way they run, their orientation, they have different actions. Okay, so we're going to be palpating them, and then we're going to ask the patient to do an action so we can feel that muscle contract. Okay, so upper trapezius is pretty easy. Patient position will be seated or standing. Can you do it laying down, prone? Sure, but this is the easiest. So I'm going to show you the easiest. Where you're going to palpate your hand position is going to be right where you would put your hands on top of someone's shoulders. Imagine they said, "Oh, my neck's so tight, would you rub my shoulders?" What you're rubbing is the upper trapezius muscle. Okay, so all of this. The upper trapezius fibers are in charge of bringing your scapula up towards your ears. So I will ask my patient, while I am palpating the muscle, can you raise your shoulder up towards your ear? Yay, and I feel that muscle tighten, and that's exactly what I'm looking for. Okay, now just to explain what you're supposed to feel, I want you to take your hand, and I want you to have your hand relaxed, and I want you to touch here right underneath your thumb. Okay, and it should feel kind of squishy. Okay, now I want you to touch your thumb to your little finger. Okay, what you just felt was this muscle contract. And feel how it's hard now. Okay, so go back, relax your hand, and concentrate what you're feeling right here. Touch your thumb to your little finger. What you felt was a contraction. Okay, so that's exactly what we're looking for. Okay, when I have my finger here and I ask my patient to raise her shoulder up towards her ear, I felt that muscle tighten, get a little bit stiff or hard underneath my finger, and so I know the muscle activated. Okay, so that is your upper trapezius. I'm gonna let you guys look up origin, insertion, innervation on your own. When it comes to listing action for upper, middle, and lower, you can list all the actions of the upper trapezius, but make sure that you circle or highlight the one that's gonna activate this particular part of the trapezius. Okay, middle trapezius is next. Patient, would you lay down on your tummy, please? Okay, and have your arms down at your side, if you will. I'm sorry. Okay, so for this one, the middle trapezius, have your head turned to the side for me, please. Thank you. Is very, very small, okay? The muscle is from here to here. It's not the middle of the muscle, okay? The middle trapezius is actually only between the spine of the scapula and the superior angle. So here I'm on the spine, here I'm at the superior angle, and then the trapezius muscle is medial to the medial border, okay? So here's her medial border. Here's the spine, here's her superior angle, so I need to be just inside of that, just medial to these 2 points, okay? So the middle fibers of upper trapezius retract the scapula. Can you squeeze your shoulder blades together? Real hard, back. There you go. And I felt that tighten, and that was very nice, okay? So again, if I find the spine of the scapula and her superior angle, okay, and I can almost just make a triangle with my fingers. Okay, 1, 2, and then go medial to those 2 points. It should be nice and squishy because you're on a lot of muscle there, and you should feel that, okay? Lower trapezius, these fibers, I'm gonna move this. Can you put your hands over your head? And now my patient's gonna fly like Superman. This is a real easy one to find because basically from the spine of the scapula down is lower fibers, okay? As long as you are medial to the scapula and lateral to her actual spinal cord, you're in a good spot, okay? So anywhere you want to be, here are her spinous processes of her spine, right here. If I'm just inside of that, or I'm sorry, I should say lateral to that, I should be good. And I will ask my patient, can you raise your arm up and fly like Superman? Cool, she did it, okay? When you raise your arms up like that, it causes you to depress your scapula, okay? It also, lower fibers is also in charge of upward rotation. And when your arms are up higher than 90 degrees, your scapula is upwardly rotated. So those are the two actions we're getting right there. Depression of the scapula and upward rotation. Okay, we're gonna go back up your list, levator scapula. Can you put your arms down by your side now? Okay. For those of you who are having trouble finding the superior angle of the scapula, you're not gonna like this one. I'm sorry. This is a subtle one, okay? It really is. I'm gonna grab a pen right behind me here, just to help you visualize this, okay? So the superior angle of the scapula is right here, and that is one of the attachment points for the levator, okay? And then it comes up like this and attaches to the transverse processes of the cervical vertebrae, okay? So if I find this superior angle and I run back and forth like this, what I'm gonna feel is a little rope. It's about the width of your index finger, okay? And what I'm doing is I'm running back and forth across it, and you can just usually feel some tightness. We're humans, we get stressed, and this muscle is one that we usually carry a lot of our stress in. And for most patients, if you find this and then put a little pressure on it and kind of massage it, they'll go, oh, that feels so good. Or maybe, ooh, that gives me a zing, like all the way up my neck. A lot of times it's a trigger point that people will find very tender, okay? This is a subtle one, especially if someone has a lot of bulk in their neck and in their upper trapezius. This one can be difficult to find. Do your best. I promise we will practice this a lot on campus, okay? But that's where you find it, okay? We're gonna move down to the rhomboids, okay? We have been dealing with the trapezius muscle. If I got out my saw or my knife and just cut that muscle and flipped it out of the way, the rhomboids are right underneath, okay? So I'm having to palpate through the trapezius to feel the rhomboids. We do have rhomboid major and minor, but they do the same action, so who cares? So we're just gonna call it the rhomboids and make it easy, okay? What we're gonna look for is the rhomboids. Yes, they retract the scapula, same as the middle fibers of the trapezius, but they also downwardly rotate and depress the scapula. Okay, so that's what we're gonna look for. So patient's gonna put her hand behind her back, and can you now lift your hand up off your back for me? Cool, okay? That causes depression of the scapula, okay? Just doing that action, okay? So when she does that, I feel a tightening under my fingers, okay? Trapezius, this part of trapezius doesn't do that. So that's not what I'm feeling. Okay, so if I feel anything tighten under my fingers, it has to be rhomboids here. Okay, so usually right between the spine of the scapula and the inferior angle of the scapula, right in there, you should be good. Last muscle we're gonna do is latissimus. And patient, would you jump up for me? Just gonna make sure I didn't skip one. We did levator, we did all trapezius, we did rhomboids. Yep, latissimus. Okay, I'm sorry. Oh, I stepped on her toe. Turn around with your back.
Give her a cookie.
Okay, latissimus is huge. Okay, latissimus comes off the thoracolumbar fascia. It comes up and around. It dives under the armpit, and then comes around and attaches at the front of the shoulder. Okay, remember, lovely lady lat lies on the floor between two majors. So it dives under the arm and inserts on that intertubercular groove. Okay, if you feel down here, you're most likely on fascia, which is harder to feel it tighten. But if you find the inferior angle of the scapula and come right below that, you're kind of on the meat of the latissimus. Okay, latissimus does three things. Latissimus extends the arm, it adducts the arm, and it internally rotates the arm. Okay, so it lets you put your hands behind your back, or it lets you scratch your back. Okay, so what I'm gonna have my patient do is I'm gonna have my patient put their arm on my shoulder. This is like middle school dance. Yay, we're gonna dance. I'm gonna be right underneath the inferior angles of her scapula, and patient, would you push down on my shoulders? Push down. There you go. Okay, she's trying to extend. She's trying to do extension, okay? If you don't want to dance with your patient, you can do it like this, of course, and just have them push down, but what I feel is tightening. We could do this sitting, we can do it standing, we can do it all kinds of different positions, okay? Again, I'm gonna let you look up insertion and origin and innervation in your trail guide. Make sure you're completing your list. Your handout that you got in class, I'm going to be asking every once in a while for you to send me either the electronic copy or a picture. Show me that you're kind of keeping up with these, okay? That's it for this video. Thank you.